We're outside Susan B. Anthony Intermediate, a school that is not only closed, but also in mourning. Take a look at the writing on the front door, R.I.P. Mr. Weiner. That refers, of course, to Mitchell Weiner, the assistant principal here, who has become the first fatality of the outbreak here in New York City. Assistant Principal Mitchell Weiner died Sunday night after being in the hospital for 5 days. A hospital spokesman has been quoted as saying that Weiner was totally overwhelmed by the swine flu, on a ventilator, slipping in and out of consciousness, and being treated with an experimental drug. He was 55 years old.
This person may have had other health problems earlier. We're trying to identify that.
However, his family has said the only underlying condition he had was gout.
Gout would not affect the severity of swine flu.
Weiner is the 6th person to die in this country and the first in the outbreak here in New York City. An outbreak that health officials now tell ABC News is spreading more rapidly than the seasonal flu. Despite an ebb in news coverage and public fear recently, the swine flu continues to march across the world. Today, Japanese health officials said the number of cases surged to 120 over the weekend. Also today, the World Health Organization is holding its annual meeting where it will discuss whether a swine flu vaccine should be made and whether to raise the global alert level.
One of the concerns when you have repeated media coverage is that people get turned off, and there's a risk of complacency in the face of true terrible disease in Mexico and real deaths. I think we have to really be on guard against complacency.
To put this in perspective, however, Mitchell Weiner is the only person here in New York City to become seriously ill with the swine flu, and the vast majority of cases across the country have been mild.